Welcome to Little Plimpton Hospital, where superior nursing is first among our goals. Today we have Greta Phillips. She is 62 and married, has 2 children. She is a 10th grade teacher at Little Plimpton High School. She has poorly controlled hypertension and diabetes.
Today we will observe 2 of our nurses interact with Miss Greta Phillips, a new admission to our outstanding medical surgical floor. Nurse A is an exemplary member of our team with unbound compassion and skills to match. Nurse B could use some improvement. Let's watch how Nurse B handles her initial introduction to Miss Phillips.
How are you feeling today? My name's Bertha Mooney, but you can just call me BM. How are you feeling?
Terrible. I had the worst headache ever, and I feel like I could throw up my breakfast.
Well, you were just sent up from the emergency room for observation, so it's probably nothing. You do look a little puffy, though, but that's just probably the diabetes. Maybe you ate something with a little too much sugar or something?
I don't know. All I had was orange juice and half a Danish for breakfast.
Man, all this talk about breakfast makes me realize I'm useless without my coffee. I'm going to go get some from the cafeteria. I was just going to ask you if you wanted one, but I realized you can't have caffeine because of your hypertension. I'm like the worst nurse. But why don't you just rest your head and I'll come back and do a full assessment on you. How about that? All right.
That's just called Nurse B. Let's see how Nurse A introduces herself.
Good morning, Greta. My name is Anne. I'll be your nurse today. How are you feeling?
Got a really bad headache.
Well, I'm sorry to hear about that. Let's see if we can fix it for you, okay? On a pain scale from 0 to 10, 10 being the worst, how would you describe it?
6.
A 6? Geez, that's very, very high. Is it like a throbbing sensation or a steady sensation?
Really steady right here.
Oh, well, that was my next question. Is it in the front of your head, the back of your head, or behind your eyes at all?
Behind my eyes.
Okay, anything that if you do, if we can make you feel a little bit better, anything that you do?
If I shut my eyes, it feels a little bit better.
Okay, well, right now, why don't you shut your eyes, I'll turn the light off, I'll go get you a warm cloth to put over your head, and we'll see if you have any medication for you to take, okay? Do you need anything else at this time?
I don't think so.
Okay, the call bell's right here if you need anything.
Okay.
For every one of our cherished clients at Little Plimpton Hospital, our nursing staff completes a full system assessment and formulates a client-centered care plan. Let's see how Nurse B administers this assessment.
Greta, I can't hear anything out of this stethoscope. Oh well, whatever. Well, your vital signs aren't too bad. Pulse is at 90, blood pressure 177 over 90, oxygen, temperature normal, respiration rate. You're breathing kind of heavy. Immunoanalysis, you have extra protein. Go figure, your bag looks weird. I don't know what that means. Whatever, you're diabetic. They always have all sorts of problems. Eats poorly, exercises poorly, probably sits around. She's just unhealthy. And a drama queen. Greta, can I get you to snap something into your lungs? I think I can. Alright. Oh, it was around my neck. Yeah, sounds clear to me. I can't find anything wrong with you, so if nothing's wrong with you, but you're vomiting all over my sneakers, so that's a problem. But your blood sugar is high. Once it comes down, you'll be fine. But anyway, I'm going to go on break now, so if you need anything, just ring your bell. The LNA will come. I'm sure they'll take care of you.
Well, I think you might have missed something, Nurse B, and it's not the tomato on your bacon, lettuce, and tomato sub. Let's observe Nurse A and her assessment of Miss Phillips.
All right, Greta, here I have the results of your urinalysis, okay? So it appears to me that you have a pretty good amount of protein in your urine, which we know excess protein in the urine can be caused by so many things, but I'm really guessing it's from your diabetes. So have you should we talk about your eating habits? Like, what's been going on lately?
Well, I do the best I can, but with my diabetes, it's really hard. And I have a very busy schedule.
Yeah, I absolutely believe you. Diabetes is very hard. Do you find it hard to follow your eating habits or to eat healthy?
Yeah, I'm always working, so I don't really get to eat. Sometimes I skip breakfast, sometimes even lunch. And when I do eat, it's just a microwave dinner.
Has this been your routine for a while?
Yeah.
Yeah. Have you lost any weight recently?
Actually, I've gained weight, which is odd, I think. I've gained like 3 pounds.
Well, you know, sometimes with hypertension and diabetes, it's not really all that uncommon to gain, you know, some water retention, which can cause your weight gain, of course. And I've also noticed a little bit of edema in your face and legs, and this might indicate fluid retention as well.
Do you think this could be causing some of my headaches and why I'm getting so tired?
It may be. The doctor prescribed some antihypertensive medication to help manage your hypertension. And it's also important to eat regularly and healthy. And I'd like to bring a dietitian in if that's okay with you, just to get you, see if we can get you on a regular eating plan, see what we can do.
Okay.
We here at Little Plimpton Hospital are dedicated to providing marvelous medication administration to all of our clients. Let's now return to the bedside of Mrs. Greta Phillips and observe our 2 nurses in action.
Greta, I have your pills for you. I have to go take care of another patient though, so here they are. Hopefully.
Are those mine?
Yeah.
Why haven't you been a better maid? That's the maid growth. Oh my gosh, it's too close.
Meds on the table. No water. Oh no, Greta just knocked her hypertension medication on the floor and doesn't even know it. Let's see if Nurse A can do a better job.
Happy birthday to you, cha-cha-cha. Happy birthday to you, cha-cha-cha. Happy birthday, dear Annie. Happy birthday to you. All right, sweetie, can you tell me your name and date of birth, please?
Greta Phillips, March 24th, 1951.
Okay. I'm just going to take your vitals real quick first because we're on a lot of, you know, anti-hypertensity meds and stuff. Okay, so we're a little high there. Alright, so I have 4 pills for you to take today. The first one, this pill right here, that is your cortisone, which is to help with your arrhythmia issue. Then we have lisinopril right here, and which helps lower your blood pressure, because your blood pressure is a little high right now.
Alright. Get the next one.
This one's a Lipitor, and this is just to help reduce your LDL cholesterol level.
Okay.
And we have this red one right here, which is your last pill. And this one's 300 milligrams of Trinate, which is to also help lower your blood pressure. Do you have any questions right now?
No.
All right, well, here you go.
Uh-oh, it appears that the client is in need of immediate assistance. Nurse B, where are you? Nurse B? Nurse B is nowhere to be found. Let's get Nurse A in here.
Bing, bing, bing.
What can I help you with, Greta?
My stomach hurts. I think I need to use the bathroom.
Okay. Let's try and get you out of bed here.
Our nursing diagnosis for Greta Phillips is knowledge deficit as evidenced by inadequate nutrition. A couple nursing outcomes for this diagnosis would be that the patient will demonstrate knowledge about diet as evidenced by verbalizing description of diet, rationale for diet, and foods allowed in diet. A couple interventions to obtain these outcomes would be provide health education instruction to the individual and family to promote healthy lifestyle and educate patient on his or her current healthcare problems.